letting other people join in. All right, so we will start. I wanted to hand it over to Suzanne and Gabby, who are the host of today's meeting, so that they can take it forward. So, Suzanne, over to you.
Thank you very much. And hello, everyone. My name is Suzanne Jones. I am a customer success manager here at Luma Health. And we are very excited that you have chosen to take some time today to join us for our Luma Basics 101 office hours. The goal of our time this afternoon or morning, depending where you are, is to review a number of the settings that you're able to access within your Luma account. So with that, we will go ahead and get started.
Hey, Suzanne.
Are you sharing your screen?
Yes, are you able to see the activity for today?
Yes, we can see it now.
Okay,
thanks.
Perfect. Yep, absolutely. So in order to get started, for those of you who have access to a Luma account, you're welcome to log in and follow along if you would like. If not, that's okay too. We're going to walk through a lot of this together. So when you log in to your Luma account, the first thing that you will see is a page that looks like this. This is what's called the activity feed. And so much like if you're a Facebook user, a Facebook feed will show you the activity for the day. There are a few actions that you are able to take from this page if you're using various forms or insurance. That would be denoted here on the side to view specific information. The other thing that you would be able to do on this page would be to filter based on activity. So if there are specific features for which your clinic is licensed, you would be able to see those activities here. You would be able to filter those and see specifically that particular information. The other thing you can do is jump to a particular date if you would like to do that. Let's jump into settings now. So from a settings perspective, if you click on the account name in the top right-hand corner, you will see a settings tab here. One other thing that I would like to point out is that you would be able to view tickets or open tickets with our support team from this view as well. So this is if you are needing a support help with something regarding your Luma account, you can open a ticket from here, and you're always welcome to email support@lumahealth.io as well. As we get into the settings, for those of you who are admin users, you will be able to see the settings tab here, which will walk us through some of the various feature controls that are available within the account. If you're not an admin user, no worries. This is going to be really helpful information for you as well, because this is going to give you some insight into what you all are available at your clinic to control on your own regarding the Luma Health settings. So there's valuable information here for both admin and what we call sub account users as well. So let's jump into settings. If I click on the settings tab here, the first thing that we'll see is general information. This is going to be exactly what it says, general information about your account. So the first thing that's going to populate is my account. This is where you would be able to personalize your account with a profile picture if you'd like to do so. You're able to change your password here, enable two-factor authentication if you'd like to do that, as well as update a time zone if that would be needed. The next tab here is My Clinic. What's important about My Clinic is this is the general setting across your practice where you're able to select the time that Luma should be sending reminders to your patients. So if I'm looking at this setting that is currently displaying here, I'm seeing that this account would be sending reminders anywhere between 2 o'clock in the morning and 9 o'clock at night. And let's say, gosh, I really don't want to send reminders to patients in the middle of the night. So in order to update that, if you would like to do so, you can come in here and change the time, both the starting time and the ending time, and that will take care of that particular setting. Now, one thing to note here as well, if you're making some of these updates, if you'll notice in the very bottom right-hand corner, you see the save button. We want to make sure that we're saving changes that we're making here. Otherwise, that won't go into effect. So we'll save that for now. Another thing that you might hear this referred to is quiet hours. And so anything outside of this particular time would be what's considered quiet hours, when Luma would not be sending any reminder messages to your patients. The other thing that you see here is the contact methods that Luma should use to send reminders to your patients. So one thing to note is that Luma is a text-first platform. So Luma will first try to detect a text number in the patient's contact. If that's not able to be determined, then it will look for an email secondly, and then lastly, a voice call. The next tab that we see is notifications. So if we click on notifications, this gives your practice and you specifically as a user an option to opt in or out of specific notifications about your patients. So you can see that there are a number of listings here where you're able to receive a notification for various activities that would occur with patients in your account. And you're able to select an email notification or a notification that would pop up in your browser here. We'll move to practice resources. So that's going to be the next tab on the left-hand side under general. So the first tab that we see here is going to be providers. This is where you will have the ability to turn on or off features for the providers that are a part of your practice. One thing to note here as well is if you are using telehealth and are licensed for that particular feature, if the provider is enabled for telehealth, you'll see a computer icon by the provider's name here. If you would like to remove a provider from a certain feature, all you have to do here is simply uncheck a box, and that's going to save that successfully here. If you'd like to turn it back on, you're able to do so here as well. If at any point you would like to add new practice resources to your Luma account, whether that is providers, facilities, or appointment types that are enabled within your EHR, please contact your Luma Customer Success Manager to do that. And you can also send a support request to support@lumahealth.io. And we'll take a quick look here as well. You can see the various facilities that are a part of your organization. The same thing would apply here as well to allow certain features for a facility as well as appointment types. We'll move into feature controls for a moment here as well. And the first one of those that we'd like to cover in the first listing here is going to be appointment reminders. And so as we begin to talk through appointment reminders, you'll see there's quite a bit of information here as far as the settings for reminders go. The very first thing that we see here is turn on appointment reminders. This is the setting where you will enable or disable all reminders in general for your practice. So this is a toggle. So if you would like to turn that particular feature off, you would toggle it to off. And remember, there's going to be a save button in the bottom right-hand corner for this one. If we want to turn it back on, we do so here as well. The second thing that we see here is the reminder cadence. And so this is going to ask, how long before an appointment should we send reminders to patients? So we see this is currently set for 1 day before the appointment. If we click in here, we can select other options as well. So if we'd like to send a reminder 7 days before the appointment, 5 days before the appointment, and 1 day before the appointment, we could do that here and enable that particular setting. And that's actually a Luma best practice to have this particular cadence set here. Moving on to additional reminder information regarding replying to appointment reminders. This next block of information allows you to choose what actions the patient can take after receiving the reminder. So this is going to walk you through this. When a patient is asked to reply, what should their options be? So the option here, confirm and cancel an appointment. They're allowed to just confirm an appointment or do nothing. And this will give you a sample message as well. As you change these settings, you can see a sample message of what that might look like to a patient. Also, when a patient replies to a reminder, how should Luma process their reply? So this is really asking if you're going to allow flexible responses from the patient or only strict answers from the patient. So accepting normal text responses such as yeah, yep, yes, nope, cancel, or are we only going to accept the exact yes to confirm or no to cancel that particular appointment? The next bit of information here is sending multiple reminders. So if a patient confirms an appointment via a reminder but has more reminders scheduled, what should we do with those messages? So should we skip them or should we keep the last one so that they get one more? As we are talking through Luma best practices, if we go back here and talk through the 7 days before the appointment, 5 days before, and 1 day before, a common practice is to allow the patient to get one more reminder if they have confirmed the 7-day reminder, to skip the 5-day reminder, but then send them the one the day before as well. So that's where you would be able to do this if you'd like to do so. Another question here, if the SMS is enabled for texting the patient, how should we handle the rest of their reminders? So if we want to continue sending those reminders via text or send any as voice calls, we could do that. And then lastly, for patients who may have more than one appointment in a day, how many reminders should we send? So should we send just one reminder for the very first appointment they have during the day, or should we send a reminder for every appointment that they have? So that's another option that we see here. The last thing that I will cover this morning is if a patient does confirm, should they be allowed to cancel later on? This is actually a question I have gotten pretty commonly at Luma. So if a patient gets a reminder at 7 days and they confirm that from that reminder, and then they get another one a day before, should they be allowed to cancel that particular appointment at that point? So yes or no, depending on the needs of your practice there. So what I'll do at this point now is turn it over to Gabby, who is going to walk us through the other feature controls that you can see here. So Gabby, I will turn it over to you.
Great, thanks, Suzanne. Then I'm just going to steal the screen from you. All right. So I'm going to cover the remaining features under feature controls, as well as user management, and then I'll cover a new feature we have called messaging activity. So just jumping back into feature controls, here we have the settings for the cancellations and waitlist feature. This setting right here will allow us to send an automatic message to patients who cancel their appointment within the number of hours you specify here. So this is a typical cancellation policy. Normally practices have it set to 24, and here's the template that we will send to the patients. This is customizable, so if you would like us to update this or add any additional information here, feel free to open a ticket and the support team can help you out. Here are a few settings to add the self-scheduler to messages, so the patient has the ability to reschedule online. And then when you scroll down a bit further, here's that main feature toggle that allows you to turn on and off the wait list. Here you'll see the setting where patients can auto add themselves to the wait list if their patient is scheduled X amount of days from now and within a certain time frame. So our best practice is usually 7 days out in the future, but within maybe 30 days, we will message a patient asking them if they'd like to be seen sooner, and if so, to reply wait list to get a text when the next available appointment opens up. This setting right here allows us to look for cancellations from either the EHR only, Luma reminders only, or both the EHR and Luma reminders. Our best practice is to have this setting enabled, so that way we're tracking cancellations from both avenues. And then these settings down here will be applied to patients that have, or availabilities that have more than one appointment booked, and if we should send offers based on matching appointment type. We would always recommend matching appointments based on appointment type, so that way time durations are set to be the same and providers know that they're being seen for the same appointment. Some of these settings down here are a bit more robust, so I won't go through all of them, but I did want to touch on these settings right here. So this setting specifies how far in the future an offer needs to be for us to send it to patients. So you can set this to whatever you'd like. Right now, we have it set to at least 1 hour in the future, but if you're able to see patients sooner, you can certainly adjust this to maybe 30 minutes or even 15 if a patient could come in that soon. And similarly below, this shows how far in advance you'd like appointments to be for appointment offers. So if you only wanted to send an appointment out that's within 30 days or a month, you can set that there as well. This setting right here specifies how we should send the offers out to patients. So we can send appointment offers in 2 ways. The first way is via the sequential method, which you'll see right here, where we send the appointment offer to each patient that fits the criteria one at a time, and giving them either 10 to 15 minutes to respond to the appointment offer. If you'd like to choose this route, you can specify how long we should wait for the patient to respond before moving on to the next patient. Our recommendation is usually leaving this to about 10 to 15 minutes, so we're not waiting too long, but so that we're giving patients adequate amount of time to reply. The second way to send offers out is via the broadcast method, which means we send the offer out to all patients on the wait list that fit the criteria, and the first person to respond gets the message or gets the appointment. And if a patient responds in either scenario, but another patient has already taken the offer, we'll just send them a message back saying, sorry, this appointment is no longer available. You'll be kept on the wait list. Then lastly, I wanted to cover this main setting right here, which allows us to specify whether we should auto create the appointment in your EHR if it supports it, or if we need to require the front desk to manually accept and book the appointment in the EHR. If your EHR supports it, we would recommend having the auto create feature enabled, so that way it saves your staff time. Moving on to feedback, here is the main on and off toggle. And this is where you can determine how many minutes after an appointment we should send the feedback message out. Our best practice is 2 hours after the patient's appointment, so that way they have enough time to settle down after the appointment and give a thoughtful response. Here you can specify how often we should send the survey out to patients. So you can either choose to send the survey out after every appointment, or if you wanted to stagger them, you could send it out maybe after every one appointment, every other appointment, or every 2 appointments. Here you can limit how many feedback messages we send to a patient in a year. Our best practice is no more than 3 in a year, but certainly feel free to increase this or decrease it as you see fit. If a patient has more than 1 appointment in a day, you can specify if we should send the feedback message for only the first appointment of the day or for every appointment. We would recommend just doing it for the first appointment of the day so we don't bombard the patient with review messages. Then finally, coming down here, you can specify which review site you want us to direct your patients to when they leave a reply to the feedback message with an answer of 8, 9, or 10. We have a handful of review sites already here. So if you had a Google site, you just want to specify Google. But if you don't see your review site here, feel free to click generic. You can input your link here that you want patients to be directed to, or if you want the support team to help you out. So we make sure we're directing patients directly to the review section of your site. Feel free to open a ticket just by emailing support@lumahealth.io. You'll also want to make sure that this is checked off. So that way we are enabling the site to be added to the message template. Otherwise, if it's unchecked, Luma will not add this link to the message template. And then lastly, for feedback, I would recommend just leaving this negative review site as is, because this is the internal detractor survey that Luma creates for you for the patients that respond a 7 or below to those feedback messages. And then as Suzanne touched on, you'll see any changes we make here, the save button will pop up, and you'll want to make sure that you're clicking that so that all of your changes are put into effect. So jumping into referrals, again, here's the main on and off toggle. And right here is where you can specify the cadence for us to send out referral messages. Our best practice is sending a total of 5 messages out to the patient with 2 days in between each message. Right here, you have the option to automatically follow up with referring providers via fax. So to turn that on and off, you would just want to click this main checkbox right here, and you can specify if we should notify the provider for scheduled, canceled, or incomplete. To see an example of the fax, you can click View Example, and you'll see that we have the referring provider name, the patient's name, whether or not they were scheduled, incomplete, or canceled, a summary of their conversation, and then the number of attempts that we tried to get the patient to schedule for. Down here, you can send a referral link to your referring providers, so that way they can send referrals directly into your Luma account. To send this link to them, you would want to click Share Form and then copy link and either email it to them or message it to them, however you can get it to the referring providers. If you click Learn More, you can preview what the referral form looks like from the referring provider's point of view. You'll see that we ask for the referring provider's name. They can type in their last name, first name, or NPI number. They'll be asked to input the patient's first name and last name, their date of birth, what their preferred contact language is, a phone number so that we know how to contact the patient, and then their street address. If they wanted to attach files, they could certainly do so by clicking the Attach Files button. And if they wanted to add another patient, they can add as many as they'd like and click Send Referrals, and those patients will be automatically populated in your Luma account, and messaging will start going out. Jumping into the scheduler, this is how you can turn on and off the scheduler. If you want to enable the address fields section, this will ask the patients for their address, and you can specify if we should make that required or not. These toggles right here will show how many hours ahead we should be showing availability. So if you wanted to make this at least 4 hours in the future, you can adjust that. And then the maximum number of days we should be showing availability. So right now we have it at 2 weeks. If you want to just lower this to maybe 10 days, you can simply just type it in there. And then the max availabilities to render. So right now we're showing 4 availabilities. Maybe you only wanted to show 2 or 6. And then down here, you can enable if we'd like to use the pre-qualification form by clicking this on and off toggle. Moving into forms, you'll see all of the forms that would be built to your account if it's a part of your package. To edit an existing form, you would click the 3 dots, click edit, and it'll bring you to the form. So here you can make changes directly to the form. If you wanted to remove a question, maybe make something required, you would click this box there. And then you'll see again, we have the save button for any changes that are made. So we want to be sure to click that. So that way, the next time it's sent to a patient, the change is put into effect. But if you wanted to preview the form, again, you would click the 3 dots here and just select preview. And Luma will show you what the form looks like from the patient's point of view. If you needed to delete a form, again, 3 dots, and then just select delete. And confirm that you would like to remove it, but right now I'm going to leave it in this account. If you needed to make a copy of a form, you can click this button right here, and you'll see that a copy was made down here with the note that it's a copy. But if you needed to create a brand new form, you would click Create Form, specify if it's an intake form or a pre-scheduling form. So if it's a patient scheduling plus form, right now we'll pretend that it's an intake form. We can make a title here for your team's tracking. Here's the first welcome template. And then if you wanted to add any type of question here, that's where you would specify that. So right now we have it as multiple choice, but let's say we wanted to change it to a drop-down menu. You'll see that if we add some verbiage here, we can have a number of drop-down options. If you click into settings, you can specify if there needs to be a description added. So you'll see a little line here popped up that you can add an extra description, and you can select multiple selections. So if the patient needed to be able to select more than one of the options here, you can specify that. By clicking this eyeball, you can save and preview. So it'll automatically save the form and bring you to the preview option. And here's what we added. So I'm clicking test. And maybe I didn't click it exactly, but you'll see that we have the drop-down menu there. And if we click next, we've completed the form. And lastly, in feature controls is the hub. This is where settings lie for the collaboration hub. So should we send unexpected replies to the hub? If yes, I would specify the minimum message length that you would want us to send them there. Right now, the default is 16, but maybe you wanted to make this shorter, so any message is sent there. You can edit that to be 5 characters long. You can specify if we should reopen chats with an unassigned status, so meaning that it needs to be assigned to a user in your Luma account. It's the same on and off toggle. And then the quiet hours for inbound chats will automatically populate what the clinic's office hours are that are set up in your account. You can also edit them directly here. Here you can specify if we should make all chats be defaulted to a secure chat. Our recommendation is leaving this enabled so that way we don't have any breaches of PHI. And here you can specify if we should set the internal chat as the default. So when the chat populates as kind of that yellow color, meaning that it's an internal chat, if you'd like to turn that off, you just want to click that toggle. Here you can specify if we should show chats for facilities in a specific user's group, or if you don't mind, we can disable that. And then hiding the message content in a patient's chat logs based on the user's provisioning. So if a user has access to the chat, do you want us to show the message content? And when a user sends a message to a patient in the hub, but it's already assigned to another user, should we automatically reassign that chat to the current user or leave it to whoever was the original assignee? And then lastly, from the patient's profile, when a user sends the message to the patient who's already assigned to another user, again, should we automatically reassign that chat to the current user or keep the original assignee? So now I'm going to hop into user management. This will show you all of the users in your account. If you click the three dots, you can edit their user. This is where you can edit their provisioning, so giving them access to the different features that are a part of your Luma account. You can edit the group they should be a part of, as well as edit the roles. And as Suzanne was mentioning earlier, the difference between admins, managers, and sub-accounts is admins will have access to all of these features, whereas sub-accounts and managers will not. If you needed to reset a password, you could click this here, and we will send the reset password email to whatever email we have on file, which is listed right here. Or if a user is no longer at the practice and you'd like to delete them, you can click delete and confirm that you'd like to delete them. But to add a new user, you would click invite user, enter their email, select the role, select which group they should be in. You can click more than one. And then here you would specify what features you'd like them to have access to. So if you only wanted a staff member to be able to send broadcasts and manage the chat, you can specify that there. I'll show you how to send the email out. So once you have all of the information here, you just click invite user. And you'll see that we've sent an email to add and set up a login for Luma to this user right here, and you can view the invite. Once they've already created their account, this notification will disappear. Under the groups tab, you'll see the different groups that we have enabled and the facilities that they're provisioned for, as well as the users who are in that group. And to add a new group, you would click add group, name it, select the facilities that are a part of this group, and select who should be put into the group. So maybe only these 3 people should be added, and we went ahead and added the test group there. So in the last 10 minutes, I want to cover messaging activity, which is one of our newer features that allows you to view the messages that have been sent today, in the past, and reminders or messages that are scheduled to go out in the future. You can see we have the previous messages in a summary right here under last messages, the last undelivered messages, and they give the reason why they were undelivered. Right now it'll say demo data, but in your actual Luma account, it can give a number of reasons why. And if you have any questions on maybe why the message wasn't sent, feel free to open a ticket for our support team and we can certainly look into it for you, as well as last patient responses, and then scheduled reminders in the future. If you click into each tab, you can also see that you have a larger list here. If you needed to search for a patient, you can certainly do so there. And then here you can add filters. So if you maybe wanted to see the last month, you would want to click into last 30 days, or maybe just yesterday's messages. You can see all of the patients that received a message depending on the date, as well as filtering by message type. So maybe you only wanted to see the appointment reminders that were sent. It'll only show the reminders that were sent out and filter out any other messages that your practice was sending. And if you're testing in your account and you want to force out a reminder to your test patient, you can do that by clicking Next Reminders and searching for test patient. Once you find them, click the 3 dots and press Send Now, and we will go ahead and force out that reminder message so you can see what it looks like from the patient's point of view. Again, you would just want to filter by date to make sure that you're finding the patient in the correct date range. So best practice would actually be clicking the next 7 days to ensure that when you search for your test patient, it populates. So I believe that was all we wanted to share with you today. Do we have questions in the chat?
Yes, we do have a recent question. The most recent question that has come in is, can you filter by message response? For example, if we ask patients to reply yes for a vaccine, can they filter that for the yes keyword?
We can filter by received from the patient. From my understanding, I don't think we can filter by keywords. So yes or no, or maybe something else. But if you did want to see patients that confirmed, you could actually find that in the reports tab. And it'll show you patients that have confirmed or are left unconfirmed, or even patients who've canceled. Let's see. What is feedback referring to? Hey, Seshan, would you mind elaborating your question about feedback? That's a great question. Nedling, your question is, it seems that patients are getting a text message. However, as the physician, the chat is only known to me via email. How can I change my settings so I get text notifications when a patient responds? Right now, we only have notification options for in product, so up here in the bell, or via email. That's a great idea though. So we will definitely want to direct you to what we call the community forum, where you can share that idea with our product team, and other Luma users can give feedback on your idea, and hopefully we can get that pushed out into the product.
And I think the feedback question, so when we are referring to feedback within the Luma platform, this is when Luma is sending messages to patients to get them to provide feedback about their appointment. And so patients are able to leave a feedback score. And if you are filtering activity based on feedback, you would be able to see those scores that patients are leaving regarding their appointment.
Right. So here's the breakdown of feedback metrics. If you look on this bar graph, you can see what patients responded, the specific number scores. So like an 8, 9, or 10 would be your promoters. 6s and 7s are technically detractors, but we would also put them in the category of passives. You can see a further breakdown here, the specific number of who responded with a promoter. So 21 people versus 3 people were passives and 3 people were detractors. Go over custom actions. Yeah, we can certainly go over custom actions. Do we, Wendrella, do we have enough time to do that?
We can cover it for the next couple of minutes. We have 4 more minutes actually.
Great. Right.
We do have a couple of other questions as well. And so regarding custom actions, if we could cover, we have a question about how do patient recalls work?
Specifically, here's the custom action for recalls. So if your EHR supports it, we can read the appointment due date and send a message based on that due date time. you can see you can specify the timing right here, but if you wanted to name your custom action for your team's tracking, add in the message here, you can do so. So maybe hi, and then if you wanted to insert what we call squigglies, which just pre-populates the following information here. So we can populate the patient's name to eliminate any spelling mistakes. You can also add in your facility name, the facility phone, and then specify the timing. Maybe when we want to send this out 72 hours before the appointment due date that we're pulling from your EHR, and then create your filters here. So should we send this message to all facilities? If no, you would want to deselect the box here that automatically selects all, and then just specify which facilities should get this. Again, for providers, and the same thing for appointment types. Maybe only checkup should be getting this follow-up. If we select all, just note that the message will be sent to all filters here. And then when you scroll down, right now this is a demo account, but in your account, if any patients fit these filtering criteria, then it'll show you a list of the patients who would get the message. And anytime you create a custom action, just want to be sure to click save. So that's the recall functionality. The appointment custom action allows you to send a message to patients based on a number of filters here. You can send it before or after the appointment time. So if you needed a message sent out to patients before the appointment, just reminding them to bring maybe their insurance information on top of the appointment reminder, you can add that there. Or if you wanted to send a follow-up message, you can specify that this should be sent after the appointment time. And then again, just specify your message up there. You would want to be sure to add your filters. And then, so this will show you how many patients fit that criteria, and then of course, click save. And then if your EHR supports it, we can send messages for procedure and diagnostic codes. So your CPT and ICD-10 codes. Same setup, you would title it, add your message, and then specify the timing. And you can add your CPT codes that you'd like us to filter for there. And then it'll populate the patients that fit that criteria. And that's the same for the diagnostic. And then for an extra reminder, you won't be able to add your template here because it's going to be based on your reminder templates. So it's simply an extra reminder. Maybe if you wanted new patients to get this as an extra reminder to bring in their insurance information, driver's license, and any other material you need from them, you can give them another touch and then just filter by the facility provider appointment type and their appointment status. All right.
We have a few questions in the Q&A box.
Yes, we do.
Okay.
Yep, we have a few additional questions. One, is there an extra fee for recalls? Recalls are a part of the acquisition and retention component of the Luma platform. So if you are licensed for acquisition and retention, then recalls would be a part of that. We have another question. Is there a way to view user activity logs? And I'm going to keep notes on these as well if we run out of time to get all of these answered.
Okay. Suzanne, can you are you looking at the questions in the Q&A or in the chat?
There are questions in both places.
Great.
Yeah. We
Suzanne
have
and Gabby, feel free to let us know when it is time, because we are on time. So in case you want to take up a couple of questions, and we can respond to the other questions via email, whatever you decide.
okay. Yeah,
sure.
sounds great.
We can answer a few, and I can type back answers in the Q&A box to Jade, Ditmar, and Nedling.
Okay.
Awesome.
But for everyone else, thanks so much for joining today. We really appreciate it. We hope you guys learned a lot.
Yes, thank you all very much. And I will take another minute or so as well to answer some questions that we have too. While we're typing as well, I do see another question. I'm not so sure if Shan, you're still on. The billing tab that you see, that's something that's not currently being used anymore. So that's one of the reasons we didn't cover that in this particular overview. As far as appointment types go, yes, we do have the ability to add additional appointment types so that patients have more options to choose from when they are booking appointments. And so appointment types are synced in through the EHR. So if there's an opportunity to add in appointment types, feel free to send a support request to support@lumahealth.io.
Hey, Suzanne, just one quick, my name's Jen. I'm a product manager here at Luma. Just a quick clarification. There's two different billing pieces within this view that you're seeing. So one is in general, which was used to collect payments for some of our smaller accounts within Luma, which is no longer in use in what Suzanne was referencing. If you're referring to the patient billing tab on the left-hand side at the bottom, that is actually a beta feature that Luma is working on to be able to collect copays upfront for patients. So if that's something that you're interested in potentially being a part of the beta, just reach out to support at Luma or your CSM, and they will help you get connected with the product manager that's owning that.
Thank you for that, Jen. Appreciate clarification there. Thank you.
Mm-hmm.
All right. If there are no more questions, so we are going to stop the session here. Thank you very much for joining us today. We will be sharing a recording of this session on the Help Center, and we'll also share the link to the Help Center piece on an email that we're going to send to all registered attendees. Thank you so much again for joining us, and we look forward to seeing you all again for the next office hours. Have a great evening.
Thanks so much, everyone.
Thank you all.